We are pleased to have as our commencement speaker this morning Dr. Charles W. Sorenson, who is the President and Chief Executive Officer of Intermountain Healthcare, based here in Salt Lake City with operations in Utah and Idaho. Dr. Sorenson is a graduate of the Cornell University Medical College. He's a board-certified urologic surgeon, has served for many years as the Chief Operating Officer, and since 2008, the Chief Executive Officer of Intermountain Healthcare. We were reflecting earlier today on the similarities between the challenges of changing healthcare and changing higher education, but Intermountain has been one of the great leaders in focusing on measuring outcomes, using analytics to measure the best clinical procedures and to apply them to improve health and well-being of those they serve. We have been privileged to work with one of their key people, Dr. Brent James, over quality in developing our new master's degree in integrated healthcare. And I will just remind Dr. Sorenson that his own official in quality has pointed out that the most important determinant of good health is the education level of people. So we're helping and working together in accomplishing that. We're pleased to have Dr. Sorenson with us. We have over 400 graduates currently working at Intermountain Healthcare and more than 400 of his employees that are currently students at WGU. In addition to that, Dr. Sorenson has been a leader in the national and international healthcare movements, and it is a great pleasure to welcome Dr. Charles Sorenson as our commencement speaker this morning.
What a great pleasure it is for me to address this wonderful group on a very special day. Thank you, President Mendenhall, for the introduction. I'm truly honored to be here and to honor those of you whose graduation we celebrate today, and to thank the faculty, the administration, and the staff for all that you've done to make this exciting day possible. It's a great privilege for me to have the opportunity to congratulate you on your degree and to compliment you for having chosen to pursue your advanced degrees here at Western Governors University. This is truly a remarkable institution. A newspaper headline earlier this week accurately noted that, quote, 20 years after its inception, Western Governors is redefining higher education. As I consider what makes it unique, what stands out to me is the combination of willingness to embrace new technologies that improve outcomes, along with the personal initiative and accountability of its students. That combination resonates particularly well for me as a surgeon and as the leader of a not-for-profit health system with a mission of helping people live the healthiest lives possible. Those two characteristics, a willingness to adopt new and better ways of doing things, and a willingness to take personal accountability, have defined your education here, and they're the keys to better health and to better health care in the years ahead. Without these core principles, we won't be able to give the next generation the longer, healthier, more productive lives, as well as affordable health care costs that we all want so much for our future. Then, if you add to those important two characteristics an additional willingness to share what you've learned with others, amazing things can happen. I'd like to illustrate those principles to you with a story of a remarkable man. His name was Dr. Homer R. Warner. He was an important teacher and mentor while I was a young college student. He later became a trusted friend and colleague for over 40 years. Although he recently passed away, Dr. Warner is still recognized the world over as the father of the use of computers in medicine. He was an inspiration to me and to many, many others. Now, it may be hard for you here today to imagine a time when computers were not a common tool in medicine. But to borrow an observation from Dick Costello, the CEO of Twitter, when I was getting my education, we didn't have the internet in our pockets. In fact, we didn't have the internet not in our pockets. But imagine this. Take yourselves back to the late 1950s, in the very earliest years of open heart surgery, and a very young Dr. Warner, having just completed his training after medical school with a residency in cardiology, followed by a PhD in physiology at the University of Minnesota, discovered a love of research and a love of being in the laboratory and learning, and he agreed to return to his home in Salt Lake City and to LDS Hospital to set up a new cardiovascular research lab. He intended that to be a job for just 1 year, but fortunately for us, it turned into 40 years that Salt Lake and LDS Hospital was his home. One of the early photos that I have of Dr. Warner you can see here. It shows him working with one of the very first analog computers ever used in medicine. He was using it in the late 1950s to study diseases of the heart valves by measuring pressures inside the heart. What makes that remarkable is that he did this in the days before cardiac catheterization was accepted for use in humans. The way to measure those pressures is to put a small plastic tube into the chambers of the heart. That requires the insertion of a catheter through a large needle in the femoral artery in the groin, up through the iliac arteries and the aorta, around the aortic arch, and down into the heart, the various chambers there to measure those pressures. The problem was that back then nobody knew what would happen if you put a catheter into a human's heart. The concern was that it might irritate the lining of the heart and cause a fatal cardiac arrhythmia. So what did Dr. Warner do? He had the procedure done on himself. Up on the 7th floor of LDS Hospital, he asked his colleagues to insert a cardiac catheter into himself, just the way I've described. After it was in place and the monitors were taped down, he ran up and down the stairs at the hospital so they could determine what his cardiac pressures were before, during, and after exercise, and he used that analog computer that you saw to analyze the waveforms produced. Why did Homer do that? Well, in his own words, he said, "We didn't think we should ask to do anything on other people that we weren't willing to have done on ourselves." That answer revolves the power of attaching deep personal accountability to a core belief. Dr. Warner deeply believed in an opportunity to improve the health of people with heart disease, and he demonstrated a remarkable willingness to put the interests of others ahead of his own. So the next picture will fast forward about 10 or 12 years. Fast forwarding, by the way, was something else that you couldn't do in the 1960s. But here's another photo of Dr. Warner sitting at the console of a very large digital computer, filling several large rooms. It was one of the first mainframe computers used in healthcare. This is right when I got to know Dr. Warner. He was teaching a class in the honors program at the university entitled Computers in Medicine. There were just 3 other students in the class, and I was quickly hooked. When the semester ended, I asked Dr. Warner if I might be able to spend the summer as a research assistant. I was delighted when he was accepted, and I ended up staying in the lab during the next 2 years of my college experience. It was a fabulous time for me, and the friendships and relationships I developed during those years have lasted ever since, continuing even after Dr. Warner's passing. Homer was a brilliant man, but he was always patient with those of us who lacked his vast experience, wisdom, vision, and intellect. I can remember on many occasions when, after spending several days trying to figure out the programming assignment he had given me, I had to admit that I was stuck. After another session with him, I'd be back on track, having learned lessons that were far more important than computer logic. Homer taught us, especially by his example, memorable lessons about teamwork, persistence, discipline, hard work, and the power of recognizing the contributions of others on the team. Since then, I've considered him to be one of my great heroes, a physician-scientist who was innovative and brilliant, yet whose greatest attributes may have been his humility, his patience, his personal accountability, and his ability to attract and energize other talented people around a noble pursuit. The result? Dr. Warner's team laid the foundation of an entirely new field of academic study, research, and clinical capabilities. He and his colleagues created one of the world's first electronic medical records with remarkable capabilities of data analysis and clinical decision support. His contributions, moved forward by many others, are now transforming not only heart care, but also cancer care, intensive care, primary care, and virtually every other area of clinical endeavor. So what does this story have to do with us here today, more than 40 years after I moved from Homer's lab to the operating room and direct patient care? I think there are three important lessons that I take from his example. First, be a lifelong learner, willing to embrace new ways of doing things. Dr. Warner certainly exemplified that love of learning long after he had finished his formal education. For many of us, probably for most of us, change is difficult. Or as one of my friends like to say, change is good as long as it's you that's changing. But in our fast-paced world, each of us needs to be willing to learn new and better ways of doing things. As General Eric Shinseki, the former Chief of Staff of the U.S. Army, famously said, if you don't like change, you're going to like irrelevance even less. Each of you has demonstrated a willingness and ability to do new things, as evidenced by your graduation from a university based on new technologies and new ways of learning. So congratulations for a wonderful start. Learning isn't just the intake of new information, though. In fact, learning isn't learning unless it changes us. Joseph Grenny, one of the authors of the book Crucial Conversations, suggests that we become both subject and scientist of our own lives. I like this idea because along with the many triumphs you'll enjoy, there will, of course, also be disappointments, even some failures. At the very least, every one of us has to live through some bad days. Grenny reminds us that even a bad day is good data. Well, it takes considerable maturity to see it that way, but if we look at ourselves, especially our mistakes, with an eye to what got in the way of a more positive outcome, we give ourselves the best opportunity to make meaningful change. Second lesson, take personal responsibility for your future. Homer certainly did that. He didn't wait for someone else to help him define new ways of doing things or create a new job. He invested in many years of formal education, but then took a much more risky path than simply entering a well-paying practice in cardiology. He did it because he saw an opportunity to learn and to deliver something better and new. Now, each of you has made a very substantial personal investment in your own version of that journey by pursuing your education, even though most of you were doing so while fully involved in earning a living, supporting your families and yourselves, and accomplishing many other great and important things. That willingness to take responsibility for your own future is something we desperately need if we're going to have better health and affordable health care in America. Far too many of us have checked out on our personal responsibility for healthy choices. Let me show you this small piece of paper as an example. This was given to me by one of our cardiologists who got it from a patient who was complaining of feeling great fatigue and shortness of breath. He thought it might be the result of interaction of the many medications he was taking. The patient was quite obviously short of breath and quite obviously very overweight. So what medications are you taking? Asked my friend, the doctor. Well, I thought you might ask that, so while I was waiting for you, I wrote them down on this piece of paper. This paper lists about 10 different medications that the patient was taking. The patient again expressed his concern that maybe some adverse drug effect was responsible for his symptoms of fatigue and shortness of breath. But something much more telling than the list of medications was found by the doctor on this piece of paper, because his patient had written down this list of medications on the back of his lunch receipt, where he'd stopped for fast food and ordered 5 double cheeseburgers and a large Sprite. I know what you're thinking, if only it had been a diet Sprite. When it comes to personal accountability, easy access to good data can help create conditions for success. You've learned that in your time here as students, and it's true in health and healthcare. Physicians will tell you that when they ask patients how many times a week they exercise, they usually say 3 or 4. But if they change the question and ask them, how many times have you exercised this week, the answer is usually 0 or 1. Relatively simple technologies that help track our steps, like the Fitbit or the app on your smartphone, are powerful tools that help many of us improve our activity levels. Why? Because these devices help keep us honest. We found in medicine that whenever we create objective data measurement systems and put them to work tracking our outcomes, we're almost never as good as we thought we were. But these data give us opportunities to improve. As Jim Collins said in his landmark book, Good to Great, in order to improve your company or to improve yourself, you've got to confront the brutal facts. So find some objective ways to measure your progress and things that are important to you. Set yourself some goals, achievable goals, and then get to work. Third lesson, find a way of sharing your growing expertise with others. Homer Warner was just one of many wonderful people who took time away from their own busy lives to help me along the way. I've tried to pay their gifts back through more than 30 years of working with our surgical residents and the students and sharing with them what I've learned. But I can tell you that I have by far been the greatest beneficiary of that sharing. As I've developed new friendships and trusted professional relationships, and I've improved my own knowledge base as people have challenged my old ways of thinking and got me to think about new ways. You don't have to provide your help and guidance in a formal educational setting. In fact, the most important things I've learned have come outside such a formal structure. Through conversations, working together for the care of patients, other shared work assignments, asking for advice from trusted and respected colleagues. Our school years give us the language and the discipline that prepare us to really learn as we go out in life. It's then up to us to go on to learn the things that we really need to know in our professions each day. And almost all of us have many opportunities to experience the joy of helping others improve their own lives through learning. Again, as I conclude, please accept my most sincere congratulations on this important day of graduation. And I have to extend a special congratulations to our Intermountain colleagues among you who are graduating. Thank you. We strive to be a learning organization. My wish for you is that this will be the beginning of a life filled with the adventures and joys of true learning, one characterized by the courage and humility to continually learn and recognize our need to learn, and the generosity to share that learning. I'm confident these are things that can bring success to you in your professions, give you a great sense of personal fulfillment, and make a better world for all those who are privileged to have you in their lives. Congratulations, and thank you.